The Great Plague of London in 1665–1666 was the last major epidemic of bubonic plague to occur in England. It was part of the second pandemic of bubonic plague, which had begun with the Black Death in the 14th century and periodically re-emerged in Europe. The outbreak in London was particularly severe, killing an estimated 75,000 to 100,000 people, approximately a quarter of the city's population at the time. The Great Plague was caused by the bacterium Yersinia pestis, which is typically transmitted through the bite of an infected flea. Fleas, in turn, were often carried by black rats, which were common in the densely populated and unsanitary conditions of 17th century London. London in the mid-17th century was overcrowded, with poor sanitation and waste management. These conditions created a perfect environment for the proliferation of rats and fleas, facilitating the spread of the disease. The warmer months of 1665 saw a rapid increase in the number of plague cases, with the disease spreading quickly through the city's narrow streets and densely packed housing. The symptoms of the bubonic plague included sudden onset of fever, chills, headache, muscle aches, and painful swelling of the lymph nodes, buboes, particularly in the groin, neck, and armpits. The disease also caused delirium and, in many cases, death within a week of symptom onset. The plague spread rapidly during the spring and summer of 1665, peaking in the hot months of August and September. The death toll was particularly high in the poorer areas of the city, where people lived in close quarters with inadequate sanitation. Many of the wealthier citizens, including King Charles II and his court, fled the city to avoid the plague, leaving the poor and those unable to escape to suffer the brunt of the epidemic. Authorities implemented various measures in an attempt to control the spread of the plague. Infected households were marked with a painted red cross and the words, "Lord, have mercy upon us." These houses were often locked and guarded, with occupants forced to stay inside, leading to high mortality within. Streets were cleaned and fires were lit in public places to purify the air, based on the belief that the plague was spread by miasma or bad air. Medical knowledge at the time was limited and treatments were largely ineffective. Doctors used a variety of remedies, such as bloodletting, herbal concoctions, and poultices, which had little impact on the course of the disease. Quack doctors and charlatans also offered dubious cures, taking advantage of the public's desperation. Thomas Sydenham, a prominent physician of the time, observed the plague firsthand. While Sydenham is best known for his work on other diseases, his empirical approach and careful observation of symptoms contributed to a more systematic understanding of epidemic diseases. The Great Plague caused massive mortality, with some areas of London losing a significant portion of their population. The epidemic left deep psychological and social scars on the survivors and profoundly affected the city's economy and infrastructure. The epidemic began to wane in the colder months of 1666. By the following year, the number of cases had dramatically decreased. The Great Fire of London in September 1666, which destroyed large parts of the city, also contributed to ending the plague by eliminating many of the unsanitary conditions that had facilitated its spread. The Great Plague of London was the last major outbreak of bubonic plague in England. Improved public health measures, urban sanitation and infrastructure, along with better understanding of the disease transmission, helped prevent future outbreaks on such a devastating scale. The Great Plague of London in 1665–1666 was a catastrophic event that highlighted the vulnerabilities of urban populations to epidemic diseases. Despite the limited medical knowledge and ineffective treatments of the time, the epidemic prompted public health responses and eventually led to improvements in urban sanitation and disease prevention. The Great Plague remains a significant chapter in the history of public health and epidemiology, illustrating the devastating impact of infectious diseases on human societies.